So just for the recording, my name's Adele and I'm an oncology dietitian, and I'm here today on War on Cancer to talk to you about prehab and rehab. So I'm just going to wait for our live participants to come in and then I'll get started. So we're expecting up to about 30 people today. Sorry, I know you can all hear the clock ticking behind me. I'll give everyone another few moments and then we will get started. Hello, welcome. I can see another few people coming in. Okay, I hope you can all hear me. What I'll do is I'll get started now, and then if anyone enters, obviously we can catch them up. I've got some notes here, so I'm just going to read off the notes as well to make sure that I tell you everything that I need to. So I'm Adele, and this is War on Cancer's 6th live event. So I'm hosting this live event. It's going to be about half an hour in total, and it is going to be recorded today. So hopefully people can catch up on things. We're going to dive deep into the topic of prehab and rehab from a nutrition sense. So I'm an oncology dietitian. So a little bit about my background. So I'm coming to you today with my World Cancer Research Fund hat on. So World Cancer Research Fund is a leading cancer charity in the UK. We're part of the World Cancer Research Fund worldwide network. We fund global research into the links with diet, physical activity and cancer. So I work with the World Cancer Research Fund sort of on different projects, translating some of the science into practical advice for those living with cancer. So I also do health profession training sessions, patient support groups and webinars and things very similar to this. So I really enjoy these, and hopefully it's a way to sort of help you along as well. I'm also an oncology dietitian working at the Royal Surrey in Surrey. So that's where I am today. So I know that the background is a little bit clinical. I have some of my colleagues here watching me today, so they all say hello too. So I'm part of a big team of oncology dietitians, and we support our patients alongside their clinical treatment. So most of my patients are having an active treatment here. I have the privilege of supporting lots of different patients here. So most of the tumour sites that I work with are people with colorectal cancer, gynecological cancers, lung cancer, pancreatic cancer, skin cancer, and neuroendocrine tumours. So a very broad range of patients having lots of different types of treatments for their cancers. But I'm about to leave the NHS and go and work for a prehab or health optimization digital company called OncoHealth. So prehab and rehab is definitely my forte at the moment, and knowing just how important nutrition is in that sort of scenario. So some practical information before I forget. If you've joined via the browser, we suggest you rejoin and download the Zoom app so it's a bit easier for you to ask questions, because I really like interactive session, and I know I could talk about food and cancer a lot for a long time, but I'd really like to answer your questions. So please be open and ask me some questions as we come along. We did have some questions sent in, so I've merged them into just some notes for myself to make sure that I cover those, because it's very important that we can answer your questions, as there's so much sort of misinformation out there on nutrition and cancer. So let's get started. So one of the things I really wanted to first cover is kind of the difference between an oncology dietitian and maybe a nutritionist. So I'm not sure if anyone is willing to share whether they've seen a dietitian before or if they know the difference between a dietitian and a nutritionist. So please do just comment in there if you have any questions or any comments. Obviously, dietitians, we have a code of conduct to follow. We're registered professionals with the HCPC. So we have a sort of a code of conduct that we need to follow to be able to practice as a dietitian. The name is protected. So we have had to have done certain training to be within that title. And we have to meet lots of needs on continuing professional development. Nutritionists, so anyone in this room or in this webinar could call themselves a nutritionist. And while there's some really well-trained and knowledgeable nutritionists, there are lots of people that can provide you nutritional advice that might not have the qualifications that you really need to know how to translate the science and to make it really relevant for you. So I just always recommend that you dig deep into finding out where you're getting your information from, who's writing it or who's telling you, so that you can sort of build and trust in that knowledge that it's going to be what you need to know. Okay, so let's move on to what is Prehab and what is Rehab. So Prehab, it's quite a sort of a new term. Rehab's obviously been around for quite a while, and that normally means recovery. So recovering from something that you're wanting to get back to some form of normal. Prehab is similar principles, but it's happening much earlier in someone's pathway. So there's three sort of pillars for Prehab. There's nutrition, there is physical activity and exercise and improving our fitness, and then there's some psychological support. And all of these three sort of pillars, they work together. They can't really be done independently. And whilst I'm talking about nutrition today, I know you have an exercise live webinar coming up soon, so that's really exciting, and I'm not going to cover that very much today, but it's one thing that's really important. And the psychological support I will cover a little bit because it's intertwined with nutrition, as I'm sure many of you may realise just how when your intake is affected, it can impact on your psychological state. So we'll cover all of those things. The other thing that's intertwined with the sort of Prehab principles is putting you in control. So obviously when you're having cancer treatment, there's so much that's taken out of your control, but these are things that you can focus on that can really impact your quality of life, your recovery, so enhance your recovery, and they can even maybe make a difference on how your treatments might work in some instances. I think it's important to say that none of these things are cures, but they work alongside the conventional treatments to help provide you support to make things hopefully a little bit easier. Okay. So Rehab's obviously been around for a while. And the things, especially in cancer care, having worked in cancer care for years, we did used to focus a lot on when people had finished their treatments. But actually, this sort of move towards having a Prehab intertwined in our services, I think is a great thing, because often when patients and people need information and we're waiting to give them information after they've finished, that might not be the right time for them. So being able to access some of this information early is hopefully something that you're all seeing in your cancer pathways or your loved ones' cancer care pathways. So obviously I'm focusing on nutrition today. So what do you need to eat? Well, it depends. So I don't have an easy answer for that, but hopefully I'm going to go through some scenarios that will help you, give you some tips that will help you wherever you are, and be able to help. So pre-surgery, so that's where we have the most evidence on a sort of Prehab nutritional status. So we know that if we can help you help you earlier to keep a stable weight, to increase your muscle mass and your fitness, your cardiovascular fitness, and how your heart and lungs are working. And also, if we can do that, often we're doing that, it can help your treatment out, your surgical outcomes. So protein is actually one of those key nutrients for most of those people that are building up for surgery. So some might need some more intensive nutrition support, and I'll come to that. But for many people, that is a simple intervention. So protein, what kind of foods have protein in there? Not sure if I'm going to get any answers today. You're all very quiet. So protein comes from things like eggs, fish, beans, pulses, lentils, dairy, soya, nuts, seeds, meat. I think I've mostly covered all of those things there. Look to my face if I've forgotten any protein sources. So they can be a really important thing. And often as we get older, some people might not be eating enough protein to meet those increased requirements before something like a surgical intervention. So it might be something that you want to be able to start now. So whilst more of the evidence is before surgery, we also know that some of these sort of this advice should come through whatever treatment you're having. So if you're looking to have some chemotherapy, radiotherapy, immunotherapy, all of those things will often have an increased need for protein. So it can be one of the easiest interventions that might help you, bits of advice to follow. Protein helps all of your muscle cells, helps your mobility. Whilst it doesn't boost your immune system, it supports your immune system. So you're obviously wanting to be able to recover, especially if you're having something like chemotherapy, to be able to get through those things. So these early interventions can really help to support your weight and your muscle mass to help you cope and recover faster. So obviously that's an ideal world. Obviously, what if you're struggling with some symptoms or side effects from your treatment or symptoms from your cancer that are actually affecting your nutrition or your intake? So things get really hard. So it's all well and good saying eat this, but actually there can be some side effects that can affect how you're eating. So we kind of call these nutrition impact symptoms. And I know I had 2 questions before the webinar started on taste changes. So taste changes is a really common side effect or symptom that we hear, especially as dietitians, and a lot of nurses hear the same thing. It's one of the things that we do struggle to treat. Health professionals, we really like to help people feel better, but sometimes the best that we can do is actually acknowledge and listen, hear what you're saying, and maybe give you a few suggestions around that. So obviously, if you're having taste changes, the first thing to do is to make sure there isn't a treatable cause. So some things that can affect your taste can be oral thrush, and that can be caused by your treatment. Your immune system could be a little bit lower. You could have high blood sugars. So that's another thing that can happen during your treatments, especially with things like if you're taking different steroids and things like that. So that can cause a coating on your tongue that can change your taste. And that is very treatable. So that would be something that you might want to get someone to double check for you. Dehydration can actually affect your taste as well. I forgot my water, I've left it in the office, so pardon the parch, but that can actually affect your taste as well. So making sure that you're well hydrated might be something that will be able to help. But actually, many of the cancer treatments that you might get can affect your taste. Sometimes it can be transient. Sometimes it can be a little bit more permanent. So often it's looking at things in a little bit more of a curious fashion and maybe trying things that you might not normally eat. So if you're favoring sweet things all day, then that's okay. You know, these diet changes are short-term. They're just during your treatments to get you through, to make sure that you're meeting your nutritional needs. So often being able to be flexible and give yourself the permission for that might be what you need. What you're not wanting to do is feel that you need to follow a strict diet. And then obviously those things that you might be feeling you should be eating, you're struggling with. And I hear that a lot, because a lot of people, if you're feeling nauseated, you're feeling a bit sick, you don't feel like eating as many fruit and veg as you might have normally wanted to. So getting through that and giving yourself permission, sometimes that's one of my main jobs, is talking through some of that sort of what's needed at the moment to help. Some people will end up going up a curry notch, so they might end up having preferring really strong flavors, spices, lots of garlic. Those kind of things can make things taste if someone's really struggling to taste anything. But then other spectrum, someone might prefer things like mac and cheese. So that's okay too. So be a bit curious, see what's easier, and then hopefully that can help you manage those taste changes. Hopefully I've addressed those two sort of questions about taste changes there. Some of the other nutrition impact symptoms that might mean you struggle to eat during your treatment or before, when you're still waiting for a treatment, might be things like nausea and vomiting, or constipation. So a lot of these things, whilst it can be frustrating, our first advice is often medication, because there isn't normally sort of diet cures that are going to help these symptoms. With nausea and vomiting, there's normally a cause, and there is some medications that can really help with that. But sometimes you might want softer or blander foods. There is some evidence on ginger as well, if that's something that you like, that could relieve things. So, but don't be afraid of using medications in these short times. With constipation as well, there are obviously some diet things that can help, but for many, like I said, eating more fiber or fruit and veg might not be something that you can cope with. So it's okay to take laxatives in the short term to get you through. And hydration is another thing that will work with bowel health. And then I just wanted to really cover, if you're really struggling, which some people are, they might often need more intensive nutrition support. So dietitians, we might be prescribing nutritional supplements, or giving you sort of lots of tips around food fortification and increasing your calories and your protein through the foods that you're eating. Sometimes we even need to prescribe tube feeds. So depending on if you're having something changed, or something blocking the sort of food tube in your gastro system, some of that, we might need to help to boost you up through a tube feed. So there's lots of different ways that a dietitian would support your body. And these are often used in a prehab context to help make sure someone is in the best nutritional state to cope with whatever they have ahead. And some people might end up needing something like that during their treatment as well. So I also had a question, what about weight gain? So obviously I'm often dealing with people on the nutrition support side of things, but I do really hear a lot that people's bodies change in different ways with different types of treatments. It can be really difficult when your body is changing, and you feel that you're not in control, or for some reason you aren't in control if you're on certain medications. So we know some hormone treatments can sort of interfere with the way our body composition works. And I've also seen patients whose body just ends up storing more in this sort of stressful phase when they're having their cancer treatment. So I'm a non-diet dietitian, so I would never be telling anyone to restrict their eating. That normally causes more metabolic damage in the long run, and it's more about being able to nourish your body. And I'll come to some of the sort of the ways of doing that in a little bit. What we're not wanting to do is cause yourself any more sort of metabolic damage, but also the psychological damage that can come with things like a diet, effectively. So yes, so this is where my advice is actually the same. So if you were putting on weight during your treatment, I would again look at the diet quality. So protein can be a really key nutrient at that stage to make sure we're supporting your muscle mass to help your body keep the strength up. And the other pillars of prehab is the physical activity, and that's really important, whatever our weights are, whatever our body shape is, to boost our muscle mass. It also has the knock-on effect of sort of helping our body, helps out our body and our mind, and we can rest a bit better. So the other thing that can happen when you're stressed, you might find you're not sleeping as well. So sometimes someone will come to see me about food and I'll actually talk about something completely different, and it might be that we chat through sort of ways of coping with stress, or some sleep interventions to help rest, because all of these things are completely normal during cancer treatment, but really might be impacting on someone's ability to sort of meet their goals, sort of whatever they're wanting to achieve. So sometimes it's taking a step back, and focusing on other things that aren't that number on the scale. So I'm hoping that that's sort of helped. I always say moving rather than trying to burn off calories, focus on things that you enjoy. And that joy can have that knock-on effect of helping to comfort you in a really stressful time. So next little section that I have on here is what happens if you're coping okay. So many people do cope quite well with their cancer treatments and really might find that their nutritional intake is quite normal, and they might want to know what to eat to be a little bit more healthier. And that's where I'm pretty pro on the fibre. So more fruit, more veg, more plant-based foods. So I'm not saying you definitely need to go down the vegan or vegetarian route at all, but incorporating more plant-based foods, we know that's good overall. So more plant-based protein, a little bit less animal-based. And plant foods have the added benefit of loads of fibre. So fibre is good for so many different things, helps to nourish our gut bacteria, helps to make us feel full and satisfied from our food. And it's linked with a lot. It seems to be linked with a little bit of risk reduction for cancer recurrence. For some disease, it's obviously not a cure, but it might be something that might support your body. So that's something to incorporate. The reason I've saved it for after I've talked about sort of if you're struggling is because many people do struggle. And if you're not able to increase your plant-based eating during treatment, then that's absolutely fine. And it might be a focus that you want to do more in the rehab phase. The other thing is you might have had some sort of permanent changes to your anatomy and physiology with surgery and your treatments or radiotherapies. So you might be replumbed a bit differently. And there might be things that you just can't tolerate after or during your treatment. So that's okay too. It's sort of learning the new normal to what you can eat and drink to get the best out of the food that you need to. Okay. The other thing, yes, obviously movement is all through all of this pathway. The more you can move, the better, and just listen to your body, knowing that you can hopefully increase that moving at different stages throughout your cancer treatment. Yeah, okay, so I've finished all my little notes here, and that's pretty much perfect on time for 20 minutes. Does anyone have questions? Come on, people, ask me something. All right, well, you're all very quiet. That's okay. That's allowed. So thanks for listening. So I know the next live event will be in 2 weeks on the 10th of December, which the War on Cancer app will cover the topic of exercise during and after cancer treatment. So I think that's a really great topic because it will tie in really well with what I've been talking about today. The live event will be hosted on the War on Cancer by the War on Cancer community manager, Lindsay Matthews. So she's a breast cancer survivor and a fitness coach. So it sounds like she'll be really knowledgeable on the topic for you. If you have any questions for me or War on Cancer about this event or the next one, you're welcome to email War on Cancer at hello@waroncancer.com. So I know they'll be there to answer any questions. I'm on social media as well, Huggy_dietitian on Twitter and Instagram. If you have any questions, then just ask. That's what I'm there for. Well, thanks, guys. I think we can wrap things up today. That was short and sweet, but hopefully I've helped you understand something in a small way.